Hi and welcome. I'm trying to learn medicine today, cat scratch fever. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, I'm going to set it your own risk. We're talking about illness and also scars, skin things, dermatology. And this is no medical advice. We're just reading about it. Cat scratch fever. A rare disease affecting all the systems of a body. It may follow superficial damage to the skin from a cat bite or a scratch from a cat or a fawn. So just a fawn? Do we mean just like do we call it? The branches sometimes have like a rose. Symptoms. A few days after the scratch, a small blister containing pus develops on the site of the injury. Between 2 to 6 weeks after the injury, the site becomes painful and swollen. Now it gets interesting. Okay, but just medically. A few days after the scratch, there is a small blister with pus and develops. And after 2 to 6 weeks, at the site of the injury, it becomes painful and swollen. Lymph glands that drain the site of the injury may become inflamed and swollen with pus, sometimes with serious abscesses. I don't know where the lymph glands are, what we're talking about. There may be a slight increase in temperature with headaches, chills, tiredness, and a general feeling of ill health. Sometimes a rash appears on the hands and feet. Duration. The disease can last from 2 weeks to several months. If serious abscesses develop in the lymph glands, a long period of convalescence may be necessary. Causes. The exact cause of cat scratch fever is unknown, but it may be a virus. And why is it now a fawn? Because the fawn had previously scratched a cat which had virus. What interesting, what ways the cat can transmission the virus? Are there maybe other animals who can transmit it? Maybe like the fawn after having eaten the cat. Whatever animals eaten our cat. The exact cause of cat scratch fever is unknown, but it may be a virus. Treatment in the home. Follow normal home treatment for fever. Rest in bed, a light diet and large quantities of fluid. When to call the doctor? If a pus-filled blister develops on the site of the injury and becomes painful and swollen. Okay, if there's a scratch or bite of a cat, it would be interesting if there's any type of other animal. There's certainly another type of animal which has it. Because then we could just examine all the animals and then we could find who has the virus which no one else had. If a pus-filled blister develops on the site of the injury and becomes painful and swollen, then visit the doctor. What the doctor might do, as cat scratch fever is not a condition that can normally be diagnosed by the family doctor, he or she will send the patient to hospital for tests. At the hospital, the doctor may take a sample of tissue from the blister for examination under a microscope in the laboratory. It may become necessary to drain any abscesses that form in the lymph glands. And again, this book is from the 80s. Maybe some things are outdated and all the people know what it is for. It may become necessary to drain any abscesses that form in the lymph glands. Outlook. Cat scratch fever usually clears up spontaneously within 4 weeks. I don't understand cat scratch fever. I mean the virus. I don't understand the nature of the virus. Now it would be interesting if only wild or house or domesticated cats or home cats have it. Pets. But I think we're talking about domestic home cats. And then also how long can the cat transmit it? I think that's very interesting. Far beyond over just cat scratch fever, the virus is, I think, interesting. Now, that was cat scratch fever. Cat scratch fever. If you were here for medicine or cat scratch fever, then you can go directly to the next part of medicine. Did I say what is? To medicine, we will do now the standing yoga. If you participate in the standing yoga, then it's better the arm risk. Good is stable stance, but feet is standing together, that's not so good as The feet are set together, we're breathing in, lifting the arms up. Ears raised. And breathe out the arms again down. Again, in the arms up. And hold the arms down. And now the police on the side. We can lift the arms and out up, arms to the side. We begin lifting the arms up. Hold them to the other side. We fill it up. Out and lean back for cripples in the morning, draw the shoulder blades together. Again, in and up. Out and back, draw the shoulder blades together. In and up, make an inch space between the toes, the height and seek between the feet, the height and seek playing palm tree. Up the arms to the side, breathe out, breathe again in the arms up. And out, sink down into half chair. Out, open the arms to one side. Breathe again in the arms up. And out, sinking again down. In, up. Hands to touch and lean back, the feet in front. Again in. And out, lean again. Again into the middle. And out, the arms down. We're leaning onto our knees, standing cat and cow. Breathe in. And out, make a round back, belly, heel of the back of the cat. Breathe again into the middle. And out now a cow. Make a belly back. Again into the middle. Breathe out, heel of the back of the cat. Again into the middle. And out, belly back. Again in. And out we're coming with a jump back up. Bringing the arms again up. And out we open them to the side. Again into the middle. Now out the arms on the sides, down we're going down into the chair. Breathe in, come halfway up. Come high up. And out and we're coming up. Breathing in, reach high. And out, open to one side. Breathing in, up. And out we're sinking again down into the chair. Breathe in, come halfway up. And out and we're coming up. Now across the arms, intertwine the fingers. Breathe in and reach high with the flow. And breathe out, reach around. Hold on the back, the drill. And in the arms up. Now across the arms, intertwine the fingers. We are ready right now. Breathe in, reach high. Breathe out, reach in front. Hold on the back. Again in the arms up. And breathe out, come up with the zip toes. And sink down into the foot chair. And breathe again in, come up. On the toes. And breathe out again down. Again, in and up. And out, the arms over the sides down. And we're going down. Now we're doing the marmot. Breathe in a bit, right leg. And breathe out and stretch with left leg. Breathe in, change. And then out and stretch with right leg. Breathe in, change. And out and stretch with left leg. In. And out and stretch with right leg. Auch legs against the river and breathe out. Now the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder, the right hand. Breathe in, take the arm again in. And breathe out and again down. Now breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, hand again down. And out and down. Now we're doing the pelican. Make a hand with space between your feet, shift the weight to the heels, and breathe in and come down. And out and up. Again in and down. And out and up. Again in and down. Out and up. And the last time, in and down. And out and up. Now the trebuchet is contemplated. Take hold onto the elbows with the hands and gently swing from side to side. And hands down and feet again together. Breathe in, come halfway up with straight back, monkey half lift. And breathe out again down. Breathe again in, straight leg, monkey half. And out and down. Now breathe in, the up time swan, arms off the sides up. And again down. Now we're going to do the sun god, legs wide apart. And we're breathing in, lifting the arms up. And breathe out, sinking down. You can come up into tiptoes. And you can breathe in and pretend to push something imaginary up. You can stay also flat foot. Again, in and up. And put it down. In and up. And down. In and up. And out and down. Now, modified garland pose. Toes open to the outside. One and space between the heels. Breathe in, lift the arms up. And breathe out and we're sinking down. Place the elbows against the inside of the leg. Now we're breathing in. You can do this version. And you can do now breathing out and go up of the back. And then in. Back into the garland pose. Now you breathe in. Or you do the second version. And you breathe out and you come up in one straight line. And again in. And breathe out, back into the garland pose. And breathe again in. And out we're coming up in one straight line. You can go also back up with the back. And the arms up. And out and down. One more time, breathe in. And out, you can come up, tuck the pelvis in, come up in one straight line. Or you go up with the back, and the arms down, breathe in, the arms up. And out, back into the garland pose. Now all together, breathe in, straight back. And out we're coming straight up. And now we're doing that Stitch of Venus. Intertwine the fingers behind the back and bring them over to one side. Breathe again in. And out, turn the head over to one side. And the chin down to the clavicle. Now breathe in. And out and pull the arm and the shoulder in. Breathe again in, lift the gaze. Turn the head over to the other side and bring arms over to one side. Breathe again in. And out, head down, chin down to the clavicle. Try to remove the exercise. Breathe again in. And out, pull the arm into the shoulder down. Breathe in, lift the gaze. And you can do it now another time, or you do the diver, which is a lot for the back. Legs wide apart, arms up to a T, breathe in. And if you want to try it with your back at your own risk, you go down, straight back, make a round back, this can go onto the back, and you come to the crown of the head first up. Or you continue with a Stitch of Venus. Another time, breathe in. Lean forward with a straight back, this can go onto the back, make a round back, come to the crown of the head first up. And the last time the diver, breathe in, bend forward with a straight back. Make a round back. Come to the crown of the head first up and down, and we're ending also with a Stitch of Venus at the back. And we're ending with your cashew almost ending. Intertwine the fingers behind the back, feet is in paper tone up, straight back, breathe in. And out, head over to one side, chin down to the clavicle, and pull the hands down to the ground. Breathe in, lift the gaze. Turn the head over to the other side, breathe again in. And out, bring the chin down to the clavicle and pull the hands down to the ground. Breathe in, lift the gaze. Turn it back into the middle. In the sky hug. Breathe in, lift the arms up. And breathe out, lean back. Long arms. Again in and up. And out and lean back. Again in. And out the arms down. We're doing the eagle swings. Breathe in, lift the arms up. And out the arms down. Now the cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch. and lower the hands down to heart center. It was the standing yoga. I thank you very much, and until next time.